Welcome back. I'm Paul Chartier. These two ladies are from Bluegrass Care Navigators. How about that?
Good job.
Catherine Lotzer, Christiane, welcome.
Thank you. Glad to be here.
You're kind of a newbie at Bluegrass Care Navigators.
A little over 2 years.
And Catherine, you've been there how many years?
I've been there 9 years.
And you're young.
That's right.
Did you come right out of college?
Sure.
Yeah?
I always tease and tell people I don't think of myself as old enough to have worked somewhere for 9 years.
Yeah,
but I'm
isn't that amazing?
It's pretty amazing.
Yeah.
But I'm so thankful for the agency, and
Yes.
the work that Bluegrass Care Navigators is able to do has been, it continues to be amazing and grow.
What do you do there?
I am the palliative nurse coordinator. So I have the opportunity to work with our patients and families through palliative care.
Which means?
Palliative care is for patients that have a serious life-limiting illness and need some support with some symptom management. So we have providers, we have doctors and nurse practitioners that are experts in symptom management, and they are able to really work with those patients that are having symptoms. We are thankful, we are thankful for the providers in the community that make referrals to Bluegrass Care Navigators Palliative Care, and then they allow us to work with their patients and target those symptoms.
Hospice, and we're going to get into you in a minute, is amazing. And for you to come on with smiling faces, great spirits,
Bright colors.
for what you do, because it's not always a happy ending, but your attitudes, and I'm sure they carry over to your team, the nurse, the doctors, the patients, the families, because if everybody is upbeat about what's going on, it's not going to be some dark, we know the ending, but it doesn't always need to be sad. And you are at Bluegrass Care Navigators for a reason.
I am.
Why?
I am what they call a provider liaison. So it's kind of the conduit between medical staff, clinical staff, and providers out in the community. So in order for them to know who to refer, when to refer, how to refer, all of those good things, then we need people out there who can help educate, provide resources, talk to their staff, provide in-services so that the staff surrounding these providers, whether that be in the hospital, in doctors' offices, nursing homes, assisted living, senior housing living, that's what we do. We go and we talk to them about what services we have, when it would be appropriate to have our services, and how to refer to them.
And your passion for Bluegrass Care Navigators Hospice came about because of what?
Well, that's I'll try to make it brief. I mean, we don't have all night, but it's a really important story. It started 14 years ago when my grandmother was in hospice care. And she was in hospice care for a little over a year, and we got to experience a really beautiful, family-oriented type care.
Yeah,
I mean, they came to the home. You can't even describe all of it, although I would love to. Well, fast forward to 5 years ago, my husband was diagnosed with an incurable cancer, and we had hospice care, and I knew what they could provide, I knew what they could do, and I'm like, we're going to call because they're our support.
Absolutely.
Yeah.
Why would someone not call hospice? What are the barriers for you to get more people involved in hospice?
That's a really good question, and we love that question because it gives us the opportunity to dispel some myths and to say, hospice care, a lot of people have the barrier that, oh, well, that means the end.
Right.
The very end. Well, not really. I mean, hospice care is for months of life, not weeks, not days.
Right.
When you get to that point, exactly, exactly. And oftentimes a longer life with palliative and or hospice care. You find that the symptoms are relieved, the family is not as stressed, you've got all these things taken care of where now, okay, we can live and we can enjoy what time is left.
It's a very emotional time. It could be a very sudden time. with all this stuff going on that the family's going through, they don't have the expertise or
Right.
the experience to know about the drugs, the meds, the this, the that. Bring hospice in. Give your phone number, give your website right now.
The website is bgcarenav.org. Very simple, www.bgcarenav.org.
Okay.
And the 1-800 number is 855, what is it? 492-0812.
Good
Thought I had
good
it.
save.
Good save. It'll come to me, yeah.
Okay. It used to be called hospice. Now, hospice is under Bluegrass Care Navigators. What is going on?
So I'm going to look at Christy because this is a
Yes.
really exciting opportunity
It is.
at Bluegrass Care Navigators. So this is our 40th year. So lots of celebrations and all the great care that Bluegrass Care Navigators, formerly Hospice of the Bluegrass, has been able to provide for patients and families in the area. So under the service umbrella, there is lots of different programs. Leading that program is going to be Bluegrass Hospice Care, which we're happy to touch upon today. There is Bluegrass Palliative Care. There is Bluegrass Extra Care, Bluegrass Transitions Care. There is wide programs available for folks. You know, we have had calls, and I've received calls from folks when I'm in the office, and they just say, what's going on over there? You know, please direct me and certainly educate them on the services that we're able to provide.
For families that are hearing all these different new definitions, what issues are they going through other than typical hospice care that they would want to call you to get some of your help?
It's for the continuum of care. What we identified were that, you know, with hospice care and palliative care, there are still some other areas where there are gaps in health care. And we find as people are discharged from the hospital and they don't stay on their care plan, or, you know, they just have a host of symptoms that need addressing, whatever that may be, we have tried to develop care that will address those needs for the people who are falling through the gaps. And that's why, you know, people say, well, why are you adding so many services? Because there's a need for them.
There's a need for it, exactly.
Yeah.
Absolutely, absolutely.
Did you want to say something?
No, sir.
Okay, well then that's enough. In the hospice world, you have great services that people may not want to pick up the phone because there's the phone call. This is it.
Yeah.
Do they know the great financial benefit to them?
We try to help
Tell-
educate to that.
Let's do it right now.
And I think, you know, in order to do that, we have to address who you would have on your team and what that means to you as a patient and a family
Yes.
under Bluegrass Hospice Care.
Yes.
You have an entire interdisciplinary team at your service. And even though we say it's 24/7, that doesn't mean they come in and live in the home
Right.
with you and
Right.
take, you know,
Yes.
full-time care of you. It
Yes.
means that they're available
Right.
by phone or by a visit
Yes.
or by whatever. So heading up that team, we have 13 board-certified physicians in hospice and palliative care. Under them, we have nursing staff, okay? They would lead up that team that comes to your home. You would have a social worker who can help get through some of those dynamics of maybe you have some dysfunction in the family, maybe you need to apply for Medicaid, maybe you just don't even know what this whole process is
Right.
about and you need help, you know, psychosocial kind of things. So you have a social worker there. Then you have aides who can come in, do baths, do, you know, fold laundry, do whatever you may need up to 5 days a week for a few hours. And then you also have volunteers who are a core part of what we do. They can come and just read to you. I have to tell you a story about my grandmother. Have to get this in because it's the cutest little story about a volunteer. My grandmother was 83 when she had hospice care. And she had a volunteer who would come and just be her companion for a couple of hours a week. Her little volunteer would drive up in her little Volkswagen. She'd come in. She was 93 years old.
Awesome.
So we laugh about, you know, our little caretaker,
Yeah.
our little volunteer, you know, babysitting
Older
my
than she-
grandmother.
yeah.
I mean, it's sweet. We have volunteers from all ages.
Correct.
Someone has an issue, they don't know where to go, they can call one phone number
Correct.
and get a quarterback. And that quarterback has different people on that team
great analogy.
that can talk to the family and say, these are all the resources we have. Why would they not call you?
There's, yeah.
And I've been through it.
Right.
It makes no sense to have these resources and tell people how much hospice costs.
So I want to first say I think educating is extremely important. Having those discussions with your family members, you know, having those documents, you know, putting your wishes down on paper
Huge.
so that you can tell
Yes.
your families,
Yes.
tell your family, you know, this is what I would like and these are my wishes.
Yes.
So we're thankful to be here today to be able to educate, you know, the viewers and let them know, you know, Bluegrass Care Navigators is here. There is a wide variety of resources. You know, call that number. Be sure and call and just say, I need some guidance. And there's going to be a friendly person on the other end who's going to be able to help guide you through the different services that we have available.
Yeah. And I think that's
Yeah.
the key. You know, when you make that phone call, that doesn't mean, you know, or a doctor refers you to hospice care. That doesn't mean you're going to have hospice care.
Yeah.
It is your choice. It is your care plan. It is what you discuss with your family. It is all about you and what you want.
You will tailor care for that family.
Absolutely.
And again, why would they do it?
Correct.
I'm going to ask you one more time.
There's-
What's the cost?
Oh,
It is covered by private insurance, Medicare, Medicaid, and if all else fails,
yeah.
Right.
it's covered by just generous
Right.
donors and our foundation. So there again, why don't
Again,
people call?
having been through it, and my dad did not think he was ready for hospice.
Because ready means, in some people's minds,
very end.
Yeah, that
Right.
I only have days or whatever left. And what we try to educate in that situation is that, you know, hospice does not determine death. The disease
Right, right.
and the prognosis determines when you will die.
Yes.
So just because hospice is called doesn't mean, oh, now I only have days. That's not how it works. So
Hospice
it's an
is-
education process.
It is, and I want this to be shared with as many people.
Sure.
To say whether you've got a parent or somebody in the home, in assisted living, in the hospital, wherever they are, you come to them.
Well, and think about, wherever home is, that's where
Yeah,
we go.
right.
Correct.
And think about in, say, assisted living or nursing home, you're getting the best care they provide
Yes.
there for routine care and
But they
skilled
have
nursing
barriers.
and whatever. Right. And so when you add hospice care to it and our whole
completing-
team, you're adding another layer
Absolutely.
of support
Yes.
Absolutely.
for that person. And in the home too, to the caregiver, to the family,
You've passed every test by answering every question. the one where there was a little whatever was the phone number, so we'll give it the phone number again.
It is 855-492-0812,
And the website, and then we'll say goodnight.
bgcarenav.org.
God love you for what you do. Families have no idea what they don't know.
And maybe they will now.
They need to
Thank
make the
you.
phone call with
Thank you.
whatever
Yes.
that rambling phone number was. Happy New Year. Hope it's a big year for you.
Thank you so much.
Thank you and
Thank you.
thank your team.
We
Thank you.
appreciate it.
Thank
I'm
you.
Paul Chartier. We'll be right back on Heart of Gold.